the Director General of the WHO gave a speech yesterday about vaccine access, and he was saying that some countries are going around COVAX, driving up prices and attempting to jump to the front of the queue and call for rich nations to divert more resources and more help to COVAX. Is that something that you or the department are worried about as well? Is that something you think is happening? And secondly, can you remind us what Australia is actually doing as part of the international agreements? Because you mentioned last week that we could be looking to actually get some supplies out of COVAX for Australia.
Yeah, so we were a very early adopter of the COVAX initiative, and that, amongst other mechanisms, have been a demonstration of our commitment to a global response to a global pandemic. And I think we absolutely need to remember that, and Australia is committed to supporting particularly the Pacific and Southeast Asian countries in our region with exactly that issue. The COVAX initiative is an interesting one. It's essentially a buyers club. Using the ability to have large amounts of money to purchase vaccines, it allows us to spread our risk, in a sense, in diversifying our portfolio of vaccines for Australia, but also supports exactly that global effort to allow large numbers of vaccinations at an affordable price for countries that would otherwise not be able to afford them. So I think in a global pandemic, a virus problem in any country is a virus problem for the world. And so we're not out of this global pandemic unless we really address that. So I support the WHO's call for consideration of that.
Just a couple. Obviously, Brendan Murphy's comments about travel probably not being likely this year, have caused a bit of a stir. In your opinion, are you of the same view that we're probably not going to see international travel this year? And secondly, regarding vaccinations, obviously those that have died after vaccination are elderly and frail, but based on our vaccination strategy, they are also over 75s and so on. They're the sort of first people that we've said we want to vaccinate. How are you reconciling that? What are sort of considerations from the medical board are you guys considering when looking at those risks and needs?
So firstly, on travel, yes, I think we have to be very careful, and we've said this on many occasions. I've certainly said it, that the first vaccinations, as they roll out in a few weeks' time in Australia, is not going to change everything back to normal. So there will be a process through 2021 of returning to some sort of normal. I think it relates to the previous question about the global pandemic being everywhere. And particularly outside of Australia. We're in such a envious position at the moment compared with the rest of the world. And so, unfortunately, I think international borders changes are probably going to be one of the last things that change rather than the first. And the other part of the question...
The other question regarding how the elderly at risk, but also sort of needs to be priority, how do we
Yes, yeah. So that is a very tricky balance. So I think we know that elderly people, as is the case in Norway, elderly people that are in aged care facilities are towards the end of their life, and that's why they're in that situation often. So we know that from our own data from the Australian pandemic, of those just over 900 people that have died, they've mostly been in the very elderly group. So they are at the greatest risk of severe infection. And in fact, the mortality rate is very high once you get over 80 or over 90 if you get COVID. So it's that risk balance equation which the TGA will need to do around that, which people you should exclude from the vaccine.
Do you think there might be a reconsideration about the very, very elderly getting that vaccine, or at least being one of the very, very first to get the vaccine?
So they are beyond doubt the ones that are most likely to get severe infection, and they, as we know, both the Pfizer and the AstraZeneca vaccine have been shown to prevent severe infection. And so there's a balance there as to whether who should be excluded, and that's exactly the sort of thing that the TGA will advise us on before it's fully regulated.